So, good day sir, I'm Ashley Patigdas, student nurse of Asian College of Technology. So, for today's video, I will be doing a physical assessment 1. Today, I am going to perform the appropriate assessment of the patient. My case scenario is the 5-year-old female preschooler is brought to the clinic with the following presentation. A fever with a ear pain or otalgia and ear discharge or urticaria. According to her mother, the child had a running nose a week after the onset of the ear pain and discharge. The child is extremely becoming irritable and denies vomiting or diarrhea. So as a nurse, I am going to assess the child for the ear examination, but before the assessment, assemble the equipment and assemble the equipment supply such as otoscope and turning fork, and then do hand washing to deter the spread of microorganism. And then introduce yourself and identify the patient and examine the procedure. So good day ma'am, I am Ashley Patigdas, student nurse of Asian College of Technology. So I will be your nurse for today. And then after introducing yourself and identifying the patient, we will now proceed to the assessment. So begin the examination of the ear by inspecting the auricles for color and symmetry of the size and position, and palpate the articles for texture, elasticity, and area of the tenderness and lesion that may indicate inflammation or infection of the external ear, and then move the auricle up and down, and then press the tragus and press firmly the mastoid bone, because if the level of tenderness such as is high, it suggests that there is a mastoid other mastoid attitude. And then after that, next examine the ear canal and eardrum by using an otoscope, and position the patient's head so that you can see through the otoscope comfortably, and grasp firmly and gently for the 4-year-old or older. Put it in front and back slightly away from the head, and then insert the speculum gently into the ear canal by tracing your hand away from the patient head, and then or away from the patient face, and then note any cerumen or any serum or earwax that may infer your view, and also observe any discharge for like foreign bodies, redness of the skin and swelling, and then maneuver the speculum that you did not see until you can see as much as the eardrum as possible, and then note the color and contour of the eardrum, because manually that the lymphatic membrane is purely gray and semi-transparent, while abnormal the color are red. red, yellow, blue, or dull surface. And then after that, for gross hearing acuity test, if patient had difficult in hearing and a normal voice, hearing a normal voice, if the ask the patient that if the patient report any hearing loss procedure with the following test, so then after that, have the client occlude and air place a taking watch to 2 to 3 centimeter to the unoccluded air and then after that repeat with the other ear. And then after that, the patient reports any hearing loss. We will now proceed to the next test. So for the patient, feeling the whisper voice test, tuning fork test helps determine if the hearing loss is conductive or neurosensory in a region that for later lateralization. By performing the Weber test, so set the fork into light vibration by tapping it in your hand, and then place the vibrating tuning fork firmly at the top of the patient head or at the mid forehead, and then ask patient if there are any hearing loss she feel. And then after that, next compare air and bone conduction by performing the RNA test. So please a light vibration of tuning fork on the mastoid bone behind the ear at the level of the ear canal, and then quick place the vibrating fork near the canal and ask of the sound can be heard. The fork should face forward, maximizing the sound for the patient, and normally the sound heard longer through the add-on to the bone and then repeat the test with other. with the other ear. And then after the document any patient that after that document any patient findings, so assessing the patient in the ear by doing the ear examination. In the examination, a 5-year-old female preschooler diagnosed in apetus media or media ear infectious happens mostly in a young child, often start 2 to 7 days after a cold or other upper respiratory infection, and then symptoms may include ear ache, fussiness, fever, and losing appetite, vomiting, grumpy behavior, and also trouble and sleeping. So then after the assessment, and then after the assessment, you can now say thank you to the patient. So thank you, ma'am, for cooperating our assessment for today. Thank you for allowing me to test your ear, and that would be all. Thank you.